Chronic fatigue syndrome, also known as myalgic encephalomyelitis, is a complex and debilitating condition characterized by extreme fatigue that doesn't improve with rest and can't be explained by any underlying medical condition. This fatigue can be so severe that it interferes with daily activities and can make even simple tasks feel like monumental challenges. Chronic fatigue syndrome is more common than many might think. It's estimated that millions of people worldwide are affected by this condition, with a higher prevalence among women than men. The onset of CFS can occur at any age, but it most commonly appears in people in their 40s and 50s. Symptoms of chronic fatigue syndrome. The hallmark symptom is a profound fatigue that lasts for at least 6 months and doesn't improve with sleep or rest. This isn't the kind of tired you feel after a long day at work or a poor night's sleep. It's an all-encompassing exhaustion that can leave people feeling drained, weak, and unable to concentrate. But chronic fatigue syndrome is more than just feeling tired all the time. People with this condition often experience a wide range of other symptoms. Many report issues with memory and concentration, often referred to as brain fog. This can make it difficult to focus on tasks, remember information, or make decisions. Some people describe it as feeling like their thoughts are moving through molasses. Physical symptoms are also common in chronic fatigue syndrome. Many people experience muscle pain or aches throughout their body. Joint pain without swelling or redness is another frequent complaint. Some individuals may have headaches that are new or different from headaches they've had before. Sore throat and tender lymph nodes in the neck or armpits are other physical symptoms that can occur. One of the most distinctive features of chronic fatigue syndrome is something called post-exertional malaise, or PM. This is a worsening of symptoms after physical or mental exertion. What's unique about PM is that it often doesn't occur immediately after the activity. It can take up to 24 to 48 hours for symptoms to flare up, and this flare can last for days or even weeks. This delayed reaction can make it challenging for people with chronic fatigue syndrome to predict how activities will affect them. Sleep disturbances are another common issue for people with chronic fatigue syndrome. Despite feeling exhausted, many find it difficult to fall asleep or stay asleep. Even after sleeping for long periods, they often wake up feeling unrefreshed, as if they haven't slept at all. This can create a frustrating cycle where the person feels constantly tired but unable to get restorative sleep. Causes of chronic fatigue syndrome. The exact causes of chronic fatigue syndrome are still not fully understood, which is part of what makes this condition so challenging to diagnose and treat. It's likely that there isn't a single cause, but rather a combination of factors that contribute to its development. Viral infections are often studied as a potential trigger for chronic fatigue syndrome. Some people report that their symptoms began after a viral illness, such as Epstein-Barr virus, human herpes virus 6, or even severe cases of flu. However, no single virus has been definitively linked to chronic fatigue syndrome, and many people with the condition don't report any preceding viral illness. Immune system dysfunction is another area of interest for researchers. Some studies have found abnormalities in the immune systems of people with chronic fatigue syndrome, suggesting that the condition might involve a state of chronic immune activation. This could explain why many of the symptoms of chronic fatigue syndrome are similar to those of a persistent viral illness. Hormonal imbalances have also been considered as a potential cause. Studies have found that people with CFS often have abnormal levels of certain hormones, such as cortisol and serotonin, which play roles in the body's stress response and mood regulation. Additionally, some people report that their symptoms began during a period of high stress. While stress alone is unlikely to cause chronic fatigue syndrome, it might make some people more susceptible to developing the condition. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of chronic fatigue syndrome. Diagnosing chronic fatigue syndrome can be challenging because there's no single test that can confirm the condition. Instead, diagnosis is based on a person's symptoms and medical history, and by ruling out other conditions that could cause similar symptoms. This process can be frustrating for patients, as it often involves multiple doctor visits and tests. To be diagnosed with chronic fatigue syndrome, A person must have severe fatigue that has lasted for at least 6 months and is not improved by rest. They must also have at least 4 of the following symptoms: post-exertional malaise, unrefreshing sleep, significant impairment of short-term memory or concentration, muscle pain, joint pain without swelling or redness, headaches of a new type or severity, sore throat that's frequent or recurring, and tender lymph nodes in the neck or armpits. Doctors will typically perform a variety of tests to rule out other conditions that could be causing the symptoms. These might include blood tests to check for anemia, thyroid problems, or other medical conditions. Sleep studies might be conducted to rule out sleep disorders. Mental health evaluations may also be done to check for conditions like depression, which can cause similar symptoms. Treatment for chronic fatigue syndrome. Treatment for chronic fatigue syndrome is primarily focused on symptom management, as there is currently no cure for the condition. The approach to treatment is typically individualized, as what works for one person may not work for another. One of the main approaches to managing chronic fatigue syndrome is pacing. This involves carefully balancing activity and rest to avoid overexertion and post-exertional malaise. People with chronic fatigue syndrome often need to learn to listen to their bodies and recognize their limits. This might mean breaking tasks into smaller, manageable chunks or alternating periods of activity with periods of rest. Cognitive behavioral therapy is another treatment that some people with chronic fatigue syndrome find helpful. CBT can help individuals cope with the challenges of living with a chronic illness, manage stress, and develop strategies for dealing with symptoms. Graded exercise therapy has been controversial in the treatment of chronic fatigue syndrome. While some studies have suggested it can be beneficial, many patients report that it worsens their symptoms. The current consensus is that any exercise program for people with chronic fatigue syndrome should be extremely gentle and carefully monitored to avoid triggering post-exertional malaise. Medications may be prescribed to help manage specific symptoms of chronic fatigue syndrome. For example, pain relievers might be used for headaches or muscle pain. Sleep aids may be prescribed for those experiencing sleep disturbances. Some doctors may prescribe antidepressants, not necessarily for depression, but because they can help with pain and sleep issues in some people. Many people with chronic fatigue syndrome find that lifestyle changes can help manage their symptoms. This might include maintaining a regular sleep schedule, eating a balanced diet, and avoiding caffeine and alcohol. Stress reduction techniques such as meditation or yoga can also be helpful for some individuals. Some people with chronic fatigue syndrome explore complementary and alternative therapies, such as acupuncture, massage therapy, or herbal supplements. While scientific evidence for these treatments is limited, some individuals report finding them helpful in managing their symptoms. It's worth noting that recovery from chronic fatigue syndrome is possible, but it's not common. Some people gradually improve over time, especially with proper symptom management. Others may experience periods of improvement followed by relapses. While chronic fatigue syndrome presents significant challenges, there's reason for hope and optimism. Medical understanding of this condition is constantly evolving, with researchers making new discoveries every year. The increased attention and funding directed towards its research are paving the way for potential breakthroughs in diagnosis and more effective treatments. Now, we want to hear from you. Do you or someone you know have chronic fatigue syndrome? What symptoms did you have? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.